State Chapter. IHMA Kerala State Chapter has conducted a series of 50 sessions of Season 1 of free webinars, and this is the Season 2 of free webinars conducted by IHMA Kerala State Chapter. And dear delegates, this Season 2 of free webinars will end by this July 25, and only the permitted recordings alone will be uploaded in the YouTube, because some recordings consist of the information of the patients which cannot be disclosed in the internet. So I request all the delegates to make the fruitful use of all the webinars. And before starting the session, we should thank our master, Dr. Samuel Hahnemann, for introducing the world a holistic system called homeopathy. We should owe all our credits to our master. Now I invite Dr. Anupriya ma'am to introduce the faculty for today. Ma'am, please, ma'am.
Good afternoon, all. Myself, Anupriya. Thank you, Dr. Vinodni, for inviting me here. So, on behalf of IHMA Kerala, I welcome Dr. Vibha Maveda, ma'am. Welcome, ma'am. So, Dr. Vibha, she's a young practitioner. She has done her graduate from Aurangabad, Nasik University in 2015, and postgraduate from other international academy, Mumbai 2016. She learned homeopathy from many legendaries and got her training from many legends homeopaths like Dr. Shankaran, Dr. Dinesh Chauhan, Dr. Gordon, and many more. She is founder of Samrigi Homeopathic Clinic, yeah, and practicing at Indore. And very in very short period of time, she got good cases and have a good practice life. And she has many successful cases and articles which are published in general, like homeopathy book.com. So, welcome, ma'am, and I welcome you from IH Michaela. Okay.
Thank you, Dr. Anupriya. May I go now? Hello, may I audible?
Yes, ma'am. But
It's
your
okay.
voice is very feeble, ma'am.
Can you take a headphone ear? Anything? It's okay.
Yeah. Is it audible now?
Yes, ma'am.
It's good. Yeah. Hello. I think your net is gone. Dr. Vinodini, what
Sir?
happened?
Sir, actually, ma'am is not here, sir. I'm not able to see here.
Okay, I will call him. Call her, okay.
Yes, sir.
Dr. Vibha, you can start the session. Can turn off. Yeah.
Am I
Hello.
audible now? Hello,
I
yeah,
think
am I audible now?
you're audible. The net connection is very feeble there. So I suggest you to turn off the video. Okay.
Sorry?
Ma'am, I am turning off your
Sorry?
video.
Okay, off my video.
I will do that. Okay. You can share the screen. Okay.
Okay.
Yeah, you can. Now it's visible.
I
You can
shared
start.
my screen. Yeah, okay.
You can start the presentation.
So, okay. So, good afternoon, all of you. As my today's topic is individualized homeopathic treatment in dermatology. So, in general, when we talk about the skin, is it really something which is superficial on? So, no, it's what we feed to our mind. The mind will create pathology accordingly. So, emotions and the state of mind have direct links to our skin problem. So, we can't say that if we have the skin problem, it's something which is superficial only and not related to our mind. If something have in our mind, then only in appears or is develop some pathology or disease on our body and on our skin. If nothing is there in our mind, will nothing get anything on our skin also. So we can say nothing can happen without a reason. So there is a reason behind that. A very famous researcher and dermatologist say align the skin and the central nervous system are intertwined, and that's true. So what happens when our mind is in stress? So when the body under stress, which produces more skin sebums, more oil charges, and which can contribute to clotted pores and aggravates our acne. And this can happen with other skin problems, with the other skin diseases also. In 2008, research is published by Indian Journal of Dermatology, Venerology, and Lipology. And what they found in the research was that they selected 50 subjects with a particular pathology of psoriasis. And what they found, people's with skin condition resulting in a thick scaly patches were experiencing stressful life events such as unemployment or family death or something which are impactful on their emotional level and on their mind level. So this is exactly what we are doing in the homeopathy. We can't treat the patient only physically. We can't say that if the skin disease is there, we are going to treat the patient only physically. We involve the mind because we have to find out the root cause of the disease. And this is what we can say the individualized treatment, which is needed in the chronic diseases and which is needed in the skin diseases also. What happens when the body is free of worries and stress? Relative or hormone levels are balanced. But when face some conditions that are psychologically or physically stressful, the body's fight and flight response triggers. The body's response triggers to floats the system, and the secretion of the stress hormones are there like adrenaline and cortisol, which are the major stress hormones.
Ma'am, can you then enlarge the screen?
Yeah, sure.
Can you start the power presentation?
Yeah, sure. Wait a
There
minute.
is a little bit problem with your voice. The brace is little bit breaking. Okay.
Okay. Okay. So when we say about the diseases, if we see the global burden of diseases, in this chart we can see the skin conditions were on the fourth leading cause of the non-fatal disease burden. So what I thought, this is not the only the disease burden. This is the burden on the pocket of patients also, because skin diseases are very common. Very commonly people get, especially the fungal infections, and they are very hard to remove by other systems of medicine. But we have a beautiful system called homeopathy to unload this burden of the disease. So as an homeopath, we can unload this burden of disease. And how can we do so? I'm presenting some cases where I can present, where I can show how can we do uh, skin diseases treating very well. So let's see the first case of today. This is the case of a tinea corporis in a 28 years old male patient who is a sales head in a cement company. For the better understanding of the case, in short, let's see what is tinea corporis first. What is the pathology is? So tinea corporis, in other words, in common words, is called the ringworm, and it can happen in any part of the body. Tinea corporis is caused by a tiny fungus known as dermatophyte, and this tiny organism normally live on the superficial skin surface. And when the opportunity is right, when the circumstances are favorable, they can induce and produces itching and rashes. So, how can we diagnose this problem? For the diagnosis of tinea, we must know the location first, because the tinea is diagnosed and named according to the location only. So if the problem is on face, if the eruption is on face, it's called tinea facies. If it's on scalp, it's called tinea hepatitis. If it's on the beard only, the problem is diagnosed as the tinea barbi. It's on whole body, it's called tinea corporis. It's on foot only, then the tinea pedis, like tinea crudis for the genital areas, and tinea manus for hands only. Let's see the causes. What are the causes which maintains and make the favorable condition to grow the fungal infection? The foremost and the most important cause is living in a damp and in a humid area. Excessive sweats, participating in contact sports, wearing tight clothes, and sharing clothes and bedding or towels with others. And the foremost, very important thing, having a weak immune system. So this is in short about the pathology about which we are going to talk in the case. So let's start the case again. So what are the chief complaints of the patient? The patient is suffering from the tinea corporis since last 6 months, and the locations are given like left axilla, right thigh, around genitals, right knees, and on the right ear, a small spot on the right ear. The only symptom is that intense itching, which are aggravated at 7 p.m. only. Every day at the 7 p.m., the itching was very intense and it was intolerable. And the other aggravating factors are warm water, and which is emulated by itching only. Actually, the other complaint was bowel are disturbed since last so many years, approximately 4 or 5 years. There is an urgent urge for the stools immediately after eating. Unsatisfied stools are there, which are very sticky, and loose stools are there, which are aggravated after eating, taking something oily or fast food or tea, and the summer weather is aggravated with his stomach complaints. Patient is feeling better, empty stomach only, and there is burning around the anus sometimes, which are settled by own in 10 to 15 minutes. When I start taking case, patient start talking about his work, his office. He's like, I'm unable to talk in office meetings in front of all the dealers and all the peoples, those who are from whom I am new and those who are new to me, especially. And this hesitation and anxiety is there for initially 15 to 20 minutes only, and after this time he will be comfortable, and after that he feels the falling state. And this problem, according to him, this problem bothers him a lot, because as he is a sales head in a cement company, in daily routine he have to meet some new people to convince dealers for the deal of company. So he have to talk to new people almost daily. Other thing what he told about himself is, he said, I
Ma'am,
used
sorry
to
for
take.
interrupting.
Yeah.
Ma'am, audio is breaking, ma'am.
Okay.
Ma'am, can you check your net connection there? I think there is some problems with the internet. I think the voice is too much breaking now.
Okay.
1 minute, I will call you back. Okay.
Hello, is it better now? Hello. Yeah. Yeah, but net is showing clear. Okay. Uh, I have to put phone. Sorry. Yeah, yeah, yeah. I did right now. I opened the window also. I think now the voice will good. Just check it. Okay. 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 I'm trying. Yeah. 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 Uh,
Uh,
Hello. Is it better now?
Yes, ma'am, it is better now, ma'am.
Okay. Okay. So from where I was not audible, so I have to repeat the things.
Yes, ma'am, from the last slide, ma'am.
Okay. Okay. So as we talk about the chief complaints here, after chief complaint, when I start talking to patient during the case taking, the patient is start talking about his office, his work. So what is told that I'm unable to talk in office meetings in front of all the dealers, especially in the initial 15-20 minutes only, and the anxiety is gone after that 15-20 minutes. But that
Dr.
15
Viva, can you start? Can you just start from the first slide?
first slide, okay,
The
case,
case the from the first case from the case.
okay,
Okay. Okay.
okay.
Thank you.
So may I go now? Yeah. So the chief complains the patient is suffering from the tinea tonsillosis since last 6 months, and the location of the eruptions are left axilla, right thigh, around genitals, on right knee, and a small patch on right ear. And the only symptom is the intense itching, which are aggravated at 7 p.m. daily. And other thing which is aggravating the thing is warm water, and he feels better after itching only. The another chief complaint is his balls are disturbed since last so many years, approximately 4-5 years. He urged for the stool immediately after the eating, and there is unsatisfactory stools are there. Stools are very stinky, and the loose stools are there, which is aggravated after eating in summer weather. Summer weather is very hard for him, by taking any oily thing or by fast food, which is and patient feel better only by empty stomach. And there is burning around the anus sometimes, which is settled by own within 10 to 15 minutes. Further, when I talk when I ask more about himself, he's talking. He start talking about the work, about the office of him. He said, I'm unable to talk in the office meetings initially for 15 to 20 minutes. That 15-20 minutes are hard, and there is a lot of anxiety in that initial stage. And after that, after the when this initial stage is passed, he get confidence and he is very fluent in talking after that. Then he feels like the whole stage is mine and he is very confident. He says this thing mostly happen when the new peoples are there, when some peoples are new to me or I am new for them. And this problem is bothering him a lot because he is a sales head in a cement company, and as this post requires, he have to meet new peoples in his day-to-day job, and have to convince dealers, have to talk to new peoples about the work and all. So this problem is a big for him. Further, he talked about himself and said, "I didn't like to take risk of any kind." Means out of the fear that if he died, what will happen if he died? There is a fear of death also. He's like, who would be taking care of my parents if I'm not there? Who is looking for the marriage of my sister if I'm not there? And he doesn't want to take risk to be in the fight with anyone or putting his nose in the issues of two peoples. He is not going to talk between the fights of two peoples. Further, he said, I got anger a lot in past few days, and he is abusive during the anger, and he just want to get out of this situation, this situation when he was anger. He's like, I can't handle this situation for a long time. I just want to get out of this. Uh, as I told, there is a fear of death and there is a lot of fear of poverty. He is always like, what if money is not there? And there is a repeated dream of amorous dreams are there. Means he saw himself with different partners in the dream. He uh, he shared a happiest feeling of his life when he start earning. He's like, I felt like I am the king and I'm top of the world because the money is in my hand that time. And he have aggravation from AC, as AC causes him headache. If we see the family history of the patient, there is not much important or considering thing in the family history, except the maternal grandmother have the lichen planus and the aunt have a hypothyroidism problem only. He desires sweet a lot and disagree the oily and fast food as the oily and the fast food make him diarrhea. He is a chilly person, and his perspiration is orders very fall. What I observe in the patient, that he is a very loquacious person. When I start case taking, I just ask, tell about yourself, and everything he told by own. I didn't ask any other question in between, and his speech is very hasty. He is a very lean, thin body person, and and have a premature graying of hairs. If we see the miasmatic understanding of the case, no doubt the case is belonging between the sora and psychotic, where the psychotic miasm is predominant there. So this is all about the case. I want audience to put your views, put your ideas about the medicine, what you thought about the analysis and the medicine in this case. So
Ma'am, there are
Dr.
some
Vinodini,
remedial suggestions
yeah.
like sepia, lycopodium,
Mm-hmm.
dulcamera,
Mm-hmm.
sulfur,
Mm-hmm.
pulsatilla,
Okay.
lachesis,
Like this is okay.
arsal, silesia,
Okay.
Again, Lycopodium.
Okay. Okay. So
Again,
actually the
sulfur
suggestions are
asalbuzepinium, hyoscyamus,
okay.
argentum, aconite, bovista,
Okay.
and
There's
this
also a
analysis is from
totality there,
Dr.
no?
Kalpana. Sir? Hello,
Read,
sir?
read the analysis. Okay.
Yes, sir. Fear of death, amorous dreams, sensitive
Mm-hmm.
to rudeness, foul
Mm-hmm.
smell of perspiration, premature
Mm-hmm.
hair.
Mm-hmm. Okay. So which medicine this person suggested?
They haven't suggested the medicine, ma'am.
Okay. 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 Means this is the analysis of the case.
Yes, ma'am.
Any other suggestion, or may I go for the analysis?
Tuja, Lycopodium, argentum nitricum.
Okay. Repeating. Okay. May I start now?
Yes, ma'am, you can, ma'am.
Okay. Okay. So if we see the analysis, what we found the most peculiar things in the case, if we see on the mental level, so most prominent thing is he is loquacious, the speech is hurried, he is abusive during anger, the fear of death is there very prominently, and he is the coward person. This is very prominently presented in the case, as he doesn't want to involve in the fighting with anyone. He just want to get away from there. During even during in family, if some arguments are there, he just want to get out from all these things. He doesn't handle the stress more. This is also the main point what we have in the case. On the physical and general level, when we see the what we found the most importantly, that the eruption is aggravated at 7 p.m. sharp daily, and the stools immediately after the eating, and the mucus in the stool. And the most important generality what we found is the desire for sweet. There is a strong desire for the sweet is there. If all this important analysis, if we choose rubrics according to them, so these are the rubrics what I took according to case, or according to important point of the case. This is mind abusive insulting, mind loquacity, mind talkative talks, hasty hurried. There is fear of death, mind cowardice, mind handle things anymore cannot, overwhelmed by stress, eruptions, herpetic cineric ringworm, generalities evening 6 p.m. to 9 p.m. aggravation, because the exact 7 p.m. aggravation rubric is not there. Stool eating after, stool mucus cleaning, stool eating after immediately, generalities discharge secretion accrete, corrosive excoriating, generalities food and drink, sweet desire. And when we put all these rubrics in the repertory chart, what we found here is the lycopodium is stand first in the repertory chart, but we doesn't choose only because the lycopodium is standing on the first position in the repertory chart, but because there is indications in the cases in the case for lycopodium. That's why we are choosing the lycopodium here. For the confirmation, if we refer materia medica to confirm the lycopodium, if we see in the soul of the remedies by Dr. Rajan Sankaran by my guru, what he written in the book is lycopodium people have one big fear, and that is the fear of undertaking new challenges, facing new situations, meeting new peoples. All the situations have to be encountered if he is to achieve success, and in the face of these situations, lycopodium lacks confidence. He feels incapable. He develops an anticipatory anxiety from this lack of confidence. If we see in the boric materia medica, what is given here is in nearly all cases where lycopodium is the remedy, some evidence of urinary or digestive disturbances will be found. We have the digestive disturbance in the case here. Lycopodium is adopted more especially to ailment gradually develop. Okay. And for the more confirmation, if we see the Fatak materia medica, what is the term here is loss of self-confidence from anticipation, averse to undertake new things, yet when he undertakes it, he goes through with ease and comfort. This is prominently, all these things are prominently present in our patient. So now, why not other medicines which are stand very close in the repertory chart? Almost it is 3, 4, 5 remedies, almost covering all the rubrics except one, two is there. So why not these remedies are there? So when we see the Natsomica, why not Natsomica? So first thing, Natsomica is the complementary remedy for the Lycopodium. So Lycopodium sometimes resembles Natsomica with the irritability and impatience and the dictatorial nature. These two remedies may come very close to each other, but main difference is that the Naxomica is not a cowardly inside. He is more rash and audacious, more forceful and expressive, more impulsive and explosive. From a young age, we can see this difference. Lycopodium has a shy, introverted child, while Naxomica in child is a daring and mischievous. So here we can rule out the Naxomica. That's why the Naxomica we rule out with the Lycopodium. Why not other remedies like Staphysaria, which is also standing very close to the Lycopodium in the repertory chart. So why not to Staphysaria? Because the main feeling of Staphysaria is one is of a dignity and honor, like a person of a noble birth. For Staphysaria person, the dignity is very, very, very important. He feels that he should live up with his sense of dignity and honor. This thing is very important to select the Staphysaria, which is not there in this patient. That's why Staphysaria is ruled out here. Someone called Cilicia there. So why not Cilicia? Lycopodium develops an anticipatory anxiety from his lack of confidence. And sometimes this may appear like Cilicia. But the difference is that it is not whether he is actually capable of doing the task that bothers him. Rather, it is that his image should be protected at all costs. For Cilicia person, protecting and maintaining the image is very, very, very important. Which is from this we can easily ruled out that this thing is not there in our case. So Cilicia is afraid to go on stage, and Lycopodium is afraid to speak. And our patient there is a fear to speak in front of people and not to how to appear in front of the people. So Cilicia, in this way, Cilicia is ruled out. That's why the Cilicia is not the choice of remedy, and Lycopodium is there. Other is the phosphorus. Why not phosphorus? So Lycopodium appears sentimental, affectionate, and sympathetic like phosphorus sometimes when because he seeks out known persons, wants someone with him, even it is the next room. Out of this tremendous fear of being alone, this fear of being alone, sometimes it looks like Lycopodium. The contrast is that while Lycopodium depends and dictates peoples, he doesn't like others to depend on him. This is Lycopodium. Uh, he does not like responsibilities and avoid them as far as possible. Uh, this is Lycopodium. But once the Lycopodium take the responsibility, he accept full responsibility due to his strong sense of the duty, strong sense of the work. Lycopodium person is someone who oftenly get married late because he doesn't accept or he doesn't ready to commit to the relationship in the relationship. So when the affairs reach at the peak, he is the person who like to take back a step. But once when he accept, as I said, he have to fulfill all the responsibilities. He did all the responsibilities because there is a strong sense of duty in the lycopodium. Arsenic album. Someone said arsenic in the suggestion. Why not arsenic? So there is a feeling of insecurity in the arsenic is there. The arsenic patient sees the world as threatening and chaotic. His life is full of anxiety. There is a extremely fearful that he will lose what he has unless he is extremely cautious. This extremely cautiousness is not there in the lycopodium. That's why ruling out the arsenic album here. So the prescription was lycopodium in 200 potency. Single dose was given to the patient, and rest SL was given for TDS for 2 weeks. In the first follow-up, what changes we found in the case is bowels were better. He somewhere he started feeling confident, and there is no significant change in the itching still. So on this note, I with the same medicine, I increase the potency here. So prescribe the lycopodium in 1 and potency in a single dose here. Instead of changing the medicine, always try to change the potency first. So and the SL for rest 2 weeks. And in another follow up, what we got, there is eruption become dry, start drying. The redness of the eruption is not there. Itching is reduced up to 25%, and he feels better in the bowel. So I put the patient on SL only after the second follow up. And in next time, what found, the itching very slightly at the evening time only, and up to the 60% he feel better in the bowel symptoms, and generally he feels very better. And now what he said is the anger was controlled up to the 50%. That is the more important thing. If we are start getting the change on mental levels also, then after this follow up, just put it patient on the SL. In fourth follow-up, what I found, the itching as it is like last time. In this follow-up, it doesn't got any change. All the things are stuck, and things are like last follow-up only, like the last follow-up only. So here I changed the potency, lycopodium in 0 by 2, just 2 doses of there. The 50, I shifted him on the 50 millisiemel. And why I did this? Because the improvement is stuck, and hence when the improvement is stuck, we have to increase the potency here. And what is my clinical experience in the, especially in the skin diseases? Uh, when the improvement is stuck after the 1 and potency, I usually put the patients on the 50 millisiemen, and I got the good results in patients. And hence in this patient also, I got good result after putting him on the 50 millisiemel potency. So in the last follow-up, what we got, there is no itching, there is even no marks of the eruptions on the skin are there, and bowels are normal, and generally he feel very well and relaxed. And after that, we give the SL for 2 weeks and advise him to stop the medicine. And this is the before and after pics of the patient. So this is how we can rule out in skin cases. Let's start with the second case of our. The second case is of a skin hyperesthesia in a 35-year-old female who is a teacher by profession. So for the better understanding of the case, again, let's see in short what.
Can we go for some doubts with the first case,
Yeah, yeah,
Dr.
yeah,
Vibha?
yeah. Please, please.
Dr.
Yes,
Vinodini,
sir.
can you ask something?
Yes, sir. Yes, sir. Ma'am, this is a query from one of the doctors. Name has not been mentioned. He says that Boric mentions that Lyco should not be the first prescription. What is your opinion on this name?
Okay. See, what's my opinion is when the indications are there, I'm going for the medicine. Whatever medicine is there, if the indication is there, you can go there.
Okay.
Okay. Other
And
thing.
next question is from Dr. Jayapai. How animal remedy ruled out?
Okay. In animal remedies, there is lot of jealousy is there. There is a feeling of revenge is there in the animal remedies. Although this is the plant remedy, and what we found here, there is a fear. He has no dare to fight with anyone. He is not going to in between the fight of two peoples. So he is. We can say he is mild. What happens in plant remedies when we found in the young peoples, especially in the young males, due to show the bravery, they doesn't show you the sensitivity of them. They are not going to told you, I am sensitive, I am going to cry, I am weeping. They are not going to told you this thing. But out of the action and reaction, and what are out of the reaction on the situation, we can understand the kingdom here. So this is clearly not the case of animal, because there is no jealousy is there, there is no revenge feeling is there, there is no feeling of me versus you is there is no feeling of hierarchy is there. So this is simply ruled out from the animal kingdom here.
Okay, ma'am. Ma'am, many participants are having query regarding the 0 bar 6 potency, ma'am.
Okay, as I told here, okay, this is my clinical experience. Whenever I got the fungal infections, especially after the one impotency, whenever I increase the potency, I like to put them on the 50 millisimal because I got good result in them. So that's my clinical experience only.
Okay, ma'am. Okay, ma'am. Ma'am, can you please share your experiences on any intercurrent remedies used?
Okay, intercurrent remedies, especially basilinum, we can use as an intercurrent in the fungal infections. But if the indication of somewhere in between, we got the indication of basilinum, then and then only. Otherwise, without indication, I doesn't prescribe any medicine.
Dr. Vinodini, we can move to the next case. Okay.
Yes, ma'am. Please, ma'am.
Okay, okay. So let's start with the second case. This is the case of hyperesthesia in a 35-year-old female who is a teacher by profession. So let's see what the pathology is for the better understanding first. So hyperesthesia is the hypersensitivity of the skin. Is the condition that involves an abnormal increase in sensitivity to stimuli of the senses. So this is in simple one we can say this is the hypersensitivity of the skin. What are the causes which cause this thing and which maintain this thing? Is the first thing is the vitamin B deficiency can develop the hyperesthesia. Other thing is for temporarily hypersensitivity, too much intake of the coffee or alcohol can overstimulate the nervous system. So this can happen there also. And when the nerves are partially or completely impaired, this can also cause increased sensory stimulation. And in some diseases like autism and fragile X syndrome or ADHD, we can develop the chances of develop hyperesthesia is more there. So let's see what are the chief complaints of the patients. So patient is suffering from the hypersensitivity since last 5 to 7 years, and the location is only face. The sensitivity of the skin is only on face only and not on other parts of the body. There is intense burning, itching, and redness of the face is there. This is the main symptoms of the patient. She said, I doesn't apply anything. I can't apply anything on the face because if I apply anything, the burning and the itching and the redness starts immediately after applying anything. There is a blackish pores on the face. She have a lot of pimples which have pus and pain. The thing is aggravated by sun, most probably by sun. By taking any small stress, the thing is aggravated. Uh, she tried to apply aloe vera, turmeric, milk, gram flour with the curd, but nothing suits her. Even she is not using soap or face wash to wash the face. She is just washing her face by water only, plain water only, because nothing is suits to her. So emulsion is by cold water only. What she told about this campaign further is she this complaint is start after taking allopathic treatment for the pimples 5 to 7 years back. She took treatment for the pimples, and after the taking treatment, this hypersensitivity is start. For this problem, in last 5 to 7 years, she almost tried everything. She tried Ayurvedic or allopathic, even homeopathic, but she doesn't found any satisfied result. Or if there is result from anything, it was for the short period of time only. And after taking the allopathic treatment, she started graying hair in bunches and a lot of hair fall and dryness of the leaves there. Her pimples are started at the age of 16, and there was a big pimples, and with pus there is a lot of swelling because of that, and they are very painful and red. At last, what she took last time is she took the peeling treatment. If you people know that dermatologist giving applying some chemicals on the face, and that's called the peeling. So she took peeling treatment, and after the peeling, the pimples are reduced in size only. This much result she got from all this treatment. What she said, these pimples are there is a spot after the pimple, and this spot takes a long time to go, almost a year to go. She said, if by mistake the nail is touched on my face, the burning is immediately start after that. Another complaint is of migraine, that is since last 19 years. She said pain is ascending, then fix on a one place. There is a lot of vomiting during the migraine. She feels head will burst, and this problem will be continued for 12 to 15 hours there. Headache is aggravated by stress, by thinking in the summer, by light, hunger, by changing place, by noise, and she feels better after vomiting or in the empty stomach. But she said that this complaint is not that much now, and the migraine is only sometime is there. Only it's for some time there. Not the daily this problem she is suffering from. So further about his history, what she told, there is a constant thought in her mind about her husband. And what is the thought is he she is always one thing is going in her mind, that her husband is looking more better, looking more smarter than herself. She feels like I am feeling incomplete in myself because he is looking more better than me. There is a fear and the insecurity is there out of this look problem. So she is like, what if he leaves me? This thought is always constantly in his mind there. Whenever she got free at home, this thought is always in his mind, in her mind. Once any thought once started, it remains 8 to 10 days continuously in her mind, and she is in 24 hours she is in the same thought. And she's like, I feel to have something which can change me. By change her mean is to look by I want to change in my look, in my face. I want to look better what I am looking right now. What she said, in social gathering, when I go somewhere in the marriage or in a party, I thought that why I am like this, why I am looking like this. I'm feeling lacking in myself. What she is telling, I'm feeling lacking in myself in everything. If something happened in everything, what she expect, she is accepting her own mistake there. Means she is just not going to argue there, not going to fight there, and just to avoid the arguments and the fight, She just accept that, okay, this is my mistake, this is not your mistake. Whenever she get anger, she start harming herself. She thought to harm herself. She is crying a lot. She avoids food. She is screaming, and there is suicidal thoughts are there during anger only. And what are the thoughts during anger? Why I am alive? No will, and there is no willing to life. Nothing is there. Everything is finished. She thought, why I am alive there. She cries a lot, but she doesn't like to cry in front of anyone, because according to her, if she cry in front of anyone, people will take it as an advantage, and people feel I am a weak. That's why I am crying in front of them. She easily start crying if anyone said anything wrong to her, anything wrong or bad to her. She get married 3 years back and doesn't have child. So she told that at the age of 16, there is abdominal TB diagnosed to her, and they have that's an emergency to operate there. They operate that time, and because of that, we are not willing to plan the baby. And husband is in the support of this thing, but because of this thing, she feels depressed always. She said, I am feeling depressed, I am feeling incomplete in myself. So as she is a teacher in school, she like to spend time with kids there, not and she is actually going to school to spend time with kids only, and not for the work and the money. She likes reading. She likes reading spiritual books and newspaper. If asked about the childhood of the person, she said, I was very mischievous. There is lots of hesitation to talk in class in front of teacher and in front of all students. Although she was an scholar student, but she said, I didn't have much friends. I have only few friends are there, as I doesn't like to talk much to people. And in college, the college are very normal. She said, as my cousins are in college, I feel very protected there. There is a particular repeated and a peculiar kind of dreams are there. And what the dreams are, she feels like something danger is happening. She doesn't remember the scenario, what is going in the dream, but the feeling behind that dream is like something danger will be happen, something danger is happening. And the other dream is, there is a big river is there, and I saw water everywhere. She is somewhere, she doesn't saw herself in the dream, but there is a lot of water is there. She desires sweet a lot. She is like, if I doesn't eat sweet daily, I feel incomplete. She uh, on any way she wants sweets always daily. There is aversion from sour and spicy things. She is thirstless, chilly, and there is lot of perspiration on the face specifically. If you see the family history, there is a kidney failure uh, in a aunt of maternal uncle, sorry, and hemorrhoid in the maternal aunt, diabetes and hypertension in both the parents, and there is a sciatica problem in the system only. If you see the miasmatic understanding of the case, the case is of a sauropsychotic, where the sora is in more prominent state here. So this is all about the case. So suggestions for medicines, please, and analysis also.
Yes, ma'am. Ma'am, there are suggestions like Calcarea ars,
Mm-hmm.
Silesia,
Mm-hmm.
Calcarea car, Natrum mute,
Mm-hmm.
Tuja, Natrum sulf, Black caninum, Calcarea sulf, Oromet.
Okay.
Ma'am, many people were asking about her external appearance, ma'am.
Exterior.
Like, is she obese or not, like that?
No, she is normal looking, not so much lean thin or not so much obese.
Okay, ma'am. Ignatia, sulfur,
Okay.
calcarea sulf, natriumur, R sal. Dr. Lena says the medicine is from mineral kingdom because of lack of self-esteem.
Yeah, she is right. Yeah, Lina, you're right. And
Dr. Kalpana says insecurity, loathing of life,
mm,
hypersensitivity,
mm-hmm.
cold amelioration, touch
Mm-hmm.
aggravation, so calcarea carb.
Okay.
Macar, pulsatilla, silesia.
Mm-hmm.
Dr. Roha says wants to be protected, so it is calcarea carb.
Mm-hmm.
Magmu, lacanenum.
Mm-hmm.
Again, calcarea carb.
Okay.
So many suggestions is calcarea carb. So calcarea mure from Dr. Ranjit sir.
Mm-hmm. Okay. Any other suggestion is there?
No, ma'am.
Okay.
Ignatia, incomplete feeling. Sepia,
Mm-hmm. Okay.
sulfur. Natrum carb. Natrum ars. Apis.
Okay.
Ma'am, you can proceed, ma'am.
Okay.
Okay.
So first, I like to rule out calcarea carb because a lot of people are suggesting calcarea carb here. So see, for the selection of calcarea carb, we need to rule out that the calcarea is the need for the stability and security is there. They need the protection in calcarea there, and there is a delusion that he is weak, delusion that he is small. This is the main delusion in the calcarea carb remedies. Calcarea people seeks for the protection he needs by exploring a lot of fears. Definitely the medicine is not calcarea carb. Other thing is first I show you the analysis, then rule out the medicines. So my analysis here on the mental level, if we see there is a brooding. If as we saw in the case, as she start thinking one thing, so 8 days things are there, 24 hours things are there in the mind. So definitely the brooding is there. A rush of thoughts are there in the mind always. There is persistent thoughts are there. She is sympathetic. There is a dream of water and danger. Something is going to happen. This represents the dream of danger here. There is loathing of life, no doubt. There is loathing of life. If we see on the physical level, there is sensitiveness of the skin. There is perspiration on face, a prominent symptom, and the blackish pores on the face. Again, the prominent symptom is there. On generalities, the strong only one strong thing is there that she desires sweets a lot. Daily, she wants sweet. So on this basis, if we select the rubrics are like mind brooding, mind thoughts persistent, mind loathing life of, mind suicidal disposition thoughts, mind sympathetic compassionate to, dream danger, dreams water, skin sensitiveness, face black pores, face perspiration, generality sun aggravation sunburn, and generality food and drink sweet desire. If you notice in my rubrics and in my repertory chart, what I'm doing usually with my cases, I took symptoms from all the levels, the PQRS symptoms from all the levels. See, here is the symptom of mind also. The pathology is also there. The general important symptoms are also there. So when we select medicine who covering all these things, including the pathology, the mind, the generals, everything, I think this is the best way to select a medicine. So uh, to select a simillimum which is going to work. So if we put all these rubrics in repertory chart, see what we found here is the calcarea carp. As calcarea carp is covering all the symptoms, not only selecting because covering all the symptoms, because a lot of other medicines are also here who are covering most of the symptoms, including one or two symptoms. So as natrum carp and natrum mule both are here and both are covering very nicely all the rubrics here. Just rule out first natrum mule. Why not natrum mule? Because before that, just see the materia medica references. In the Soul of the Remedies by Dr. Rajan Sankaran, what he written here is natrum carb is very sensitive, especially to separate from the beloved and to the breaking of relationship. This line is prominently present, and this is the actual main issue in the patient's life, of this particular patient's life actually. What other lines are here about the natrum carb is natrum carb is a salt belonging from the sodic mycin. In the natrum element, we see a marked desire to form and maintain a relationship, especially on one-to-one level. This symptom, this one-to-one relationship wala symptom, we can found in every natrum salt. Means we can found in natrum mure also, natrum carb also, every other natrum carb, because this is the natrum part of, this is the quality of natrum actually. And what we see here, the fear to separate from the beloved one, this is the part of carbon. This is the part of carb here. What we found in natrum carb only. In other materia medica, see in the soul of remedy, other lines are natrum carb is afraid of a human quality of forming a group and a cast people out if they doesn't fit into the expected norms of the group. Why these lines are taking here? Because whenever she is attending a gathering, attending a party or a marriage, she feel outdated there, because of the look she feel like, why I am like that, other people are looking good, why not I am. The dream of natrum carb, including dream of danger, of robbers, dream of murder, dream of corpse, dream of water and food. So out of all these dreams, we have prominent and repeated two dreams in this particular patient. In boric materia medica, aches from slight mental exertion, worse from sun or working under gaslight. This is prominently there in the case. In Patak material, what Patak written here is occupied with set thoughts. This is the, I think, basic thing what we found in the case. This is the important thing what we found in the case. In Murphy's, what Murphy's written here is all the natrum stimulates cellular activities and increase oxidation and metabolism. This is how the natrum carb is going to work for the skin, for the particularly if we try to connect with this case, particularly like this medicine is going to work for this patient. So just see the most commonly looking medicines in the differentiation. Why not natrum mu? See, the natrum carb is a chili and the natrum mure is a hot person. There is a, in this case, there is a desire for sweet, and in natrum mure, there is a desire for salt. Natrum carb desires consolation, where exactly opposite natrum mure aggravate by consolation. You can't consolate a natrum mure person. And by misome, if we see, this is the sodic remedy and this is the psychotic remedy. Theme of in natrum carb, theme is of a vital reaction needed by a person who is alone, that is without a relationship on a one-to-one level with another human being. His forsaken alone lonely feeling gives rise to the two basic feelings of natrum carb, which are that is boredom and the anxiety. This two feelings are specifically come out in the Natrum card. Whereas in Natrum Mute, main feeling is that she will be let down or betrayed or disappointed by the person her trust depend on or by the ones she loves. This is the there is a major difference in both the medicines, and that's why here the Natrum Mute is ruled out. Why I doesn't describe the Natrum Mute here. Okay, the other suggestions I like to rule out them also.
Yes, ma'am.
Yeah. So other suggestions was most of people told about the calcarea carb. Yeah.
Yes, ma'am.
So in calcarea carb, the main feeling of calcarea carb is the need for the stability and the security is there, right? They need for there is a basic feeling that they need the security, they need the stability. This is that is the calcarea carb, which is not there here, and lot of fears are there in calcarea carb, right? There is fear of dark, there is fear of people's what other will say. This thing is most prominently we can find out in the calcarea peoples. Other remedy was silicia, I thought, right?
Yes,
In
ma'am.
silicia, the main issue is related to the image. Silicia peoples are doing things to maintain or uh, to build up an image, and they can do anything to maintain his image. So image issue is the main core issue in the silicia. So that's why the silicia is ruled out here. Other medicine was aurum met. So aurum met is the person who is like to maintain things now, because uh, uh, an aurum mate is somewhere belonging from the syphilitic miasm move. So here they like to already a built image is there, a built thing is there, and they like to maintain the things there. This is the aurum. Then so aurum is not in the means, not related far from this case. Other is the ignatia. So yes, in Ignatia, no doubt Ignatia is sensitive. There is BP. Ignatia can weep easily, but Ignatia, the element is caused by the shock. Is there by some emotional shock? So that is not there in our case. So Ignatia is also ruled out there. And if someone told this is the mineral kingdom, yeah, definitely there is lacking feeling is there. So definitely this is the mineral kingdom. So can we almost, I think, ruled out all medicines. So can we start with the other? Okay. So the prescription was Natron Carb 30 with the SL for next 4 weeks. In the first follow-up, what we find out here is mentally she feel relaxed. In this case, I like to mention that in this case, the after even the first prescription, after the first prescription, the lot of big changes are there on the mental and the physical level of the patient. So we find out that mentally she feels relaxed. She doesn't feel depressed and tense now. She become very positive about her problem now, because the problem is very chronic and she took lot of treatment for that and doesn't got satisfied result till. So she was very negative about the prognosis of her problem, and she asked me before, is my problem is treatable or is I'm going to cure or not. But now she is feeling like I am going to better now, and I am positive about my problem now. She applied aloe vera and rose water in last evening when she come to me for the follow-up. So last evening she applied the aloe vera and the rose water, and what she got, there is a burning for 4 to 5 minutes only, which was there for hours before. But right now it's for the 4 and 5 minutes only. So this is the a very positive point we got in the case. And one more thing, what she told that I'm feeling tightness in my skin now, and I feel better because of that. One thing what she doesn't mention me in the case taking, that she has cervical pain, and After taking this treatment, after taking the medicine, the cervical pain is not there. Even she drive for 3 4 days. She is driving continuously from 3 4 days. Still the pain is not there, and she forgot to mention this thing in the case taking. So she mentioned me here in this follow up. And next follow up again. Mentally, she feels better. The pimples are reappear in last 8 days, as this was the premenstrual period. So pimples are appear again, and the cervical pain is better. And again, she told me the new thing. Uh, uh, this cervical pain is like the fermentation feeling was there, which is not there right now here. So I repeat the same medicine with the same potency with SL for next 4 weeks, and in next follow up, what we find out that mentally she feel calm. There is no persistent thought now. No pimple in this last 1 month. Uh, she doesn't experience burning or itching of the skin even after exposure to sun now. And skin feels tight. There is no cervical pain is there again. So I put the patient on SL this time. After a month, she told me that there is a small eruption she got on the forehead, and itching is there, but there is no pus and pain on the eruption. So I repeat the same medicine on 200 potency now. And in the next follow-up, what we got, the eruption on forehead was not there after the medicine, but reappear in this last 2 days again, what she told. But itching is not there. Again, I repeated the single dose of nitrogen cup 200 here, and I said for the next 4 weeks. And uh, and after a month, the follow-up is like she is mentally calm. There is no any other complaint there. And what a new thing what I got here is, uh, even after applying the home remedies, she got irritated before when she started treatment. But this time she did bleaching on the face, because there is some marriage function in the family. So she bleached on the face, and she was so surprised that after even doing the bleaching, there is no burning, no redness, and no itching is there. And after that, I stopped the medicine. So we can see the video testimonial of the patient. So just enjoy the video. Sorry, it's in Hindi. So just see, I will translate later.
Ma'am, sorry for the interruption. We are unable to hear the audio, ma'am.
Yeah. So may I stop this video, means? Hello.
Ma'am?
Can you enable the ma'am, when you start sharing the Zoom now, there is an option like share the system sounds. Okay, you just go to the Zoom button. Hello.
Yeah, my sound is on system only.
No, use system sound. There is an option. Ma'am,
Use system sound.
you just please open the Zoom window, the sharing window. Okay. It's
Sorry,
okay if
doctor.
you translate that, then it will be nice. Okay,
Okay.
you can no problem.
Okay, she told that when she started treatment, even after applying the aloe vera and any home remedy, the eruption and the redness are there. But after taking treatment, nothing is there what she is explaining here only. This is the testimonial about. So, any question here, or may I have to proceed for the next case?
Ma'am, we can take some questions, ma'am.
Okay,
Can we,
okay.
ma'am?
Yeah, yeah, please.
Yes, ma'am. Ma'am, this question is from Dr. Kalpana.
Mhm.
What is the difference between natrum and calcarea because both want to be dependent?
Sorry, repeat the question. Sorry.
What is the difference between natrum and calcarea because both want to be dependent?
Okay. But calcarea need the stability also. Okay. Calcarea always need the main feeling is need for the stability and the security is there. There is a lot of fears are there in the in the calcarea group of remedies which we doesn't found in the natrum group of remedies. Instead of that, in natrum group of medicine, what we prominently found here uh, is about the brooding about something that is the, uh, about the maintaining a relationship, especially one to one level. This is prominently what we found in the natural group of remedies. There is tremendous fear, there is sadness, there is sense of isolation is there is desire for solitude is there in the natural group of remedies. uh, uh, Especially if we see they are sensitive for the separation, very sensitive. uh, so this is the 4 second lonely feeling is there in the natrum group of remedies. So that is easily we can rule out the natrum and the carbon.
Okay, ma'am. Ma'am, there is one more query from Dr. Roha Vijay.
Mhm.
Why was the potency changed to 200 later?
Okay, because see what I showed you. Yeah. What you see here, when I last time prescribed the 30 potency, after that, after a period of 1 month, then after 1 month, she got the symptoms of uh, a small eruptions on the forehead, and this small eruptions on forehead are appearing first time in the case. This is not something which she have before. This is the kind of a new symptom for the case. That's why I increased the potency here.
Okay, ma'am. Okay, ma'am.
So can we start with the next case or questions are there?
Ma'am, we can start with the next case, ma'am. Please, ma'am.
So this is the third and the last case for today. This is a case of lichen planus in a female of 60 years old. She is a housewife. For this case, I truly telling I'm not so hopeful for this case because of the age of the patient, right? Uh, Before starting the case, let's see the pathology in short, what it is. So lichen planus occur when the immune system mistakenly attacks cells of the skin or the mucous membrane. And because this is related to the immune system, that's why I'm not so much hopeful for this case. So, on skin, lichen planus appears as purplish, itchy, flat-topped wounds on mucous membrane, such as in the mouth. It forms lacy white patches, sometimes with painful sores. What are the causes which maintains or create the lichen planus? These are the possibly including causes. That is the hepatitis C. Is it certain medicines, including some drugs using for the blood pressure, for diabetes, malaria, for the heart disease. Some reactions of metals filling in the tooth, they can possibly cause, and then autoimmune reaction, meaning the body's own defense system, the immune system attack own mouth or the own skin cells by mistake. So we can develop this kind of disease. Let's see the case. The chief complaint of the case is the patient is suffering from lichen planus since last 3 to 4 years. There's a lot of itching on whole body. The eruptions are on whole body. She continuously itch for 3 to 4 years. Continuously she is itching for 3 to 4 years. There is a lot of burning followed by itching, redness after itching. The condition is aggravated by warm water, by applying warm, and by wearing some woolen cloths. And she feels she got emulated by cold water and applying coconut oil only. What she explained that first time the eruptions will start on the leg, and for this problem again she took all possible treatment till allopathic, homeopathic, ayurvedic, everything, but there is temporary relief only, and there is no permanent solution she got till. Another complaint, she have acidity. There is a bulging of stomach ache is there sometimes, which is aggravated by taking tea in the evening and ameliorated by taking water. So about the history of her, what she explains that I am tolerating all the problems, but I can't answer back to anyone. And what she said, ki, I feel insulted very easily. And why she feel insulted very easily? So she said, my dignity is very important for me. If it's damaged, it feels humiliated. I feel humiliated if someone is damaging my dignity. Because it's something which is very important for her. What others are talking about her is affects a lot to her. She can control herself during anger on small things things, and can't share things easily. She keeps things in herself only. She doesn't like to share things. She said her husband is expired 10 years back, and the tensions are start after that. What she said, no one is asking for anything at home, means no one is asking for food even. So what she feel there, she feel insulted there. See, no one is asking me, even son is not taking care of mine. And she said, I'm managing my expenses by the pension of my husband only. About the childhood, she doesn't describe, she doesn't share much things, but what she said is that are the happiest days of life, and I was very cheerful. I was average student in school. If you see the family history, nothing significantly we found in the family history, as half of the things she don't know. In generalities, she desires sweet and sour. She avoids sweet, like cake and rasgulla. She doesn't like that. She is ambithermal, and sleep is well and good. Sound sleep is there. If we talk about the miasmatic understanding of the case, so definitely the miasm of the case is psychosyphilitic, where the predominant miasm is psychotic. So this is all about the case only here. Now, I like welcoming the suggestions and analysis from
Yes,
audience.
ma'am. There are suggestions like Staphysagria, many Staphysagria suggestions.
Okay, okay. Mm-hmm. Any other?
Uh, Only till now, Staphysagria has alone come in the suggestions, ma'am.
Okay.
And Dr. Harpreet Kaur says ailments from indignation.
Mm-hmm. Mm-hmm.
Dr. Bhavesh says plant kingdom due to sensitivity.
Yeah, exactly. Mm-hmm.
Dr. Samyukta says honor and dignity affected Staphysagria.
Mm-hmm.
Colosin.
Mm-hmm.
Dr. Kalpana says insulted, dignified, anger on small things, indignation, Staphysagria,
Mm-hmm.
differential diagnosis, Pulsatla.
Okay. Okay.
From two people, Pulsatla has also came, ma'am.
So, any other suggestion or may I proceed now?
You can proceed, ma'am.
So, see the analysis first. The feeling of insulted is very important, as the anger on small things what other will say is affect her. She can't express her anger. There is dignity and honor is very important for this person. So when we put this thing on the as a rubrics what I selected is mind humiliation elements from aggravation, mind anger trifles about, mind honor wounded aggravation, mind sensitive oversensitive other says about her what, mind anger suppressed controlled, skin lichen plainness, and the generalities food and drink sweet desires. Again the mind rubrics, the pathology and the generality. And when we put all these rubrics in the repertoire chart, what we found most prominent here is staphysagra. So no doubt most of the people are right. This is the staphysagra only because it's a very clear case of staphysagra here. Uh, so let's see the materia medica reference. When we see in the Soul of the Remedies by Dr. Rajan Sankaran, the main feeling of staphysagra is one of dignified and honor, like a person of a noble birth. He feels that he should live up to his sense of dignity and honor, which is often far more than needed in a man of his position. The main feeling of staphysagra. This is the main core of the gist of the remedy, the gist of this staphysagra, what we found in the case here. In Patak, what he wrote here, the sensitive to what others says about her. So she is sensitive about that. In Boric Materia Medica, what we call is ill effect of anger and insult. Very sensitive to what others says about her. Again mentioned by Boric and Patak both. If you see in Murphy's Natural Materia Medica, what he wrote here, ill effect of anger and humiliation. Morbidly sensitive, the least word that seems wrong hurts her very much. Very sensitive as to what others says about her. This all thing what we found prominently in the case. So this is I think the simplest case of today of staphysagra. Just rule out why not other medicines than staphysagra. So lycopodium. The main feeling, what we saw in the first case also, the main feeling in lycopodium is that if the person remains small, his survival will be difficult, he will be humiliated, he will be nowhere, fears has no power. For lycopodium, power is important, okay, which is not there in our medicine. I ruled out lycopodium because lycopodium and nitromycia, platina pulsatile, all these are come close in the repertory chart. That's why I'm ruling this medicine here. Oh, why not Natrum View? The main feeling of Natrum Uraticum is that she will be let down or betrayed or disappointed by the person her trust depends on or by the one she loves. The relationship she seeks is not one of dependence like calcaria or magnesia, but of friendship or romance, a relation of on a one-to-one basis. This is the base thing what we have to, what we should have to prescribe the natural neuroticum. But not ignatia, a feeling of continuous fright or apprehensiveness that something is going to happen with all this mental state, feeling of emptiness in the stomach and the abdomen. This is what we have to for the prescription. And someone suggested a pulsatilla also here. So how we rule out pulsatilla here is the main feeling in pulsatilla is that of softness. It is like the windflower which must bend to every gust of wind in order to survive. Translated into the human situation, it is the feeling I will survive if I am soft and gentle and not hard and not rigid. Pulsatilla is someone which is very submissive, very yielding, which is not we found in the staphysagra. Instead of that, the staphysagra is very angry. Their anger is coming out like the air is bursting out from the balloon. This kind of anger of staphysagra is there, and pulsatilla instead of that is very yielding type of personality. we see the uh, platina here, platinum mat. So feeling of being humiliated, of being crushed down utter. This is the main feeling of platina here, as if by some huge power is crushing them. This is the feeling of platina. The platinum woman has the feeling of being very small, of having to grow really large in order to survive. She believes that this growth depends upon her performance, and she pushed herself to reach great height. The platina is the performer. They are the there is the feeling of the uh, good opinion from other in the platina. Okay. And there is element from deceive ambition, delusion that she is noble. If we see the complementary medicines of Staphylococcus aureus, so carcinosinum and sulfur are the complementary medicines. In carcinosinum situation is caused by being heavily controlled by the person on whom one depends, whereas that of Staphylococcus aureus is caused by being insulted by him, and not by the heavily controlled. So this is the main feeling of carcinosinum here. Humiliated and egoistic state will naturally arise more earlier in one who originally has pride and egotism. This is about the sulfur. In other words, a sulfur state of egotism predisposes to the stephysagra state of humiliation. This is how we can see the both complementary medicines here. So no doubt the prescription was staphysagra 1 m single dose, rest of acid for the 4 weeks. So what we found in the first follow-up, that itching was less. Uh, Itching was less in first 10 days. We prescribed for a month, so itching was very reduced in first 10 days. Then itching is started again. The acidity is slightly better, and anger, she doesn't observe about the anger, so she doesn't say anything. So I repeated the here the staphysagra 1 and single dose again, because she got to she initially 10 days she have no symptoms, means itching is better, but she again start medicine. So I repeat the same dose with same medicines again here. Then again, in like the last follow up, what we found here is the itching was less first 10 days, then again start. So this time what I did is, I repeat the staphysagra 1 m single dose in every 15 days here now. Let's put on the acid. So when we repeat in the 15 days, what we found, itching reduced up to 40%, and it's not constantly now, not on the full day now. Acidity is after dinner only, and anger, she is like, I am avoiding things, so anger is not there now, because she started avoiding things at home which bothering her actually. So staphysagra 1 m again in repeated in the 15 days. So in next follow up, the itching is 40 to 50% better. The acidity is after dinner for half an hour only, and anger again she's doing same thing, avoiding things, so anger is not there. So again repeating the staphysagra 1 m in 15 days. And next follow up, the itching is almost 70% better. Frequency and time period of itching is reduced now. It's 1 hour only now, which is there for 3 to 4 hours before. And there is no acidity, she feeling very calm, and the irritability is not there now. Again, the same medicine with the same potency and repetition. In the next follow-up, itching is not continuous. Itching sometimes only is there, mostly aggravated at the night, and rest all things are better. Again, the same medicine, same potency, and the same repetition with acid. And what we found in the next, there is no itching, no acidity. She feels calm, and no irritability is there. Now, if there is no symptom, so I put patient on the SL now. Again, for 1 month, I keep her on the observation. If she got any symptoms, so I'm going to increase potency. But in after a month also, she doesn't got any symptom and the things are very stable, so I stopped the medicines there. And this is the result what we found. So this is all about today's presentation. So any questions regarding this case now?
Yes, ma'am. There is one query from Dr.
Yeah.
Rohra Vijay.
Yeah.
Why was syphilitic factor considered in this case? Syphilitic
Because
myasthenia.
of the pathology. Because of the pathology.
Okay, okay.
Yeah. Any other thing?
No, ma'am.
Okay. So thank you to all the participants for the patience listening, and thank you for the to the organizers for giving me this opportunity.
Ma'am, thank you so much, ma'am. It was a wonderful session, especially your differentiation between the remedies were excellent, ma'am. Thank you so much, ma'am.
Thank you so much, Doctor.
On behalf of IHMA Kerala State Chapter, I express a deep sense of appreciation, ma'am. Thank you so much.
Thanks a lot for giving this opportunity to me. Thanks to Dr. Ranjit sir, Dr. Deepu, uh, for all the support. And
Okay, ma'am.
okay,
Thank you so much, ma'am.
okay, okay, bye.